Hello, everyone, and thank you for joining today's roundtable discussion. We're here to explore the potential role of artificial intelligence in veterinary teleradiology. So ultimately, it's a conversation to gather your perspectives and your insights, questions, and honest thoughts about AI and how it might or might not fit into your professional world. So before we get into my first question, let's all say our names and what we do. Starting with you, Dr. Taylor.
Radiologist. Yep.
Okay. Okay, is
Okay.
this your company?
It is my company. Yes.
Awesome.
My name is Thiago. Also a radiologist, and it's a pleasure to be here with you guys.
Yeah, I'm Dave Stearns. I'm the CEO of Taylor Veterinary Imaging, and I've just been with the company a short time, so I'm here to learn and maybe add if I can.
Hi, I'm Jessica Cravens, and I am the COO, and I work behind the scenes in operations.
And I'm Gracie Nolan, and I'm the Director of Operations and CFO, and I really work behind the scenes.
And I'm Ruthie. I do the marketing and socials for the company. Okay, so let's get started. What comes to mind when you hear AI in veterinary teleradiology?
I think it's a modality that is not quite there yet. I think it's being introduced. I think it's being slightly over marketed. I think it has some useful implications and applications. But I think right now, the way it's being marketed, it's being overpromised.
Yeah, I agree. I think it's here to stay, and it will get better in the future, but still needs a lot of improvement. And I think the main goal of AI for us as veterinarians, as radiologists, is actually to help us be more efficient. I believe that. I think AI is really good in telling normals, but is lacking differentials, is lacking correlation with clinical signs. So it will get better eventually, but it won't replace us, I believe.
Have you seen any examples, positive or negative, of AI in use in medical or veterinary imaging?
I have. I
Okay.
can tell a story. There is a non-client. I won't give the name, but they were offered a trial by a big corporation, a big telerad company, to exclusively use their AI product for 30 days. So they used their free trial of their AI software for 30 days. So rather than use it on new cases that came in, they went back and used it on old cases for 30 days. That old cases that already had a board certified radiology consultation. So they went back through all of their records and they just used all of their cases that they ever had a consultation. And they went back and compared the results. Because a human eye versus an AI eye right now would be the human eye would be the standard. And they found that, there was a very, very low correlation. There was 80% missed it completely, weren't even correlated. There was less than a 5% correlation. Like, this is a fracture, and AI said there was a fracture, something like that. So it was way off. It couldn't even get it. So in my mind, with the variability of species and sizes of animals and positioning and, don't get me started on heart sizes and obliquity and exposure settings, you're going to need of millions of images of every size and position and, you know, everything in order to get a big enough database for a supercomputer to go through and compare in order to make a decent correlation. So they chose not to use it. Bottom line, they said, no, we don't want it.
When was this?
Now, this was recently, within 6 months.
I don't have any personal experience using AI, but I have heard from attendees at different conferences or new clients or current clients that have used it in the past. And I would say on average, the opinion is that they don't like it, that most general practitioners don't like it. They do find that it is not reliable. But again, that's just my small interaction with a handful of people so far.
There's a couple of companies that there's one company that's, I think, probably doing it a little bit better than other companies, and that their AI software is giving a more general reading. It's kind of highlighting a region and saying, hey, there's something wrong here, and giving a couple of differentials rather than giving like 90 differentials of what's going on with this region. Versus another company that's saying everything that's wrong with this whole picture, which makes it very wrong, which, it confuses the practitioner and they just throw up their hands. And so the other company that's kind of giving it more of a general lip service, I think they've got kind of a good idea of how to use it initially. And I've told them that. I said, I like the way you're doing it because it's not forcing them to make a decision. It's saying, hey, there's something kind of going wrong here. Saying, yeah, you've got pneumonia. Definitely you've got a fracture. Yes, it's pathologic, or yes, it's traumatic. Yes, you just have something wrong here. You should have it interpreted.
You did point something out earlier, and you said that AI was its own modality. And I thought that was very interesting because you're right. It is kind of like its own modality. And I do wonder about its reliability, just between actual human veterinary radiologists. There's sometimes a different opinion on certain characteristics in x-rays, and some people are more conservative, and then some people are more aggressive, and they're more prone to calling things versus like another radiologist who wouldn't. And it would be interesting to see how AI would differentiate between those two types of personalities, if they would be more conservative or more aggressive with their diagnoses.
The other concern is that AI is so cheap and teleradiology is so expensive that it kind of gives the practitioner of a cheap way out, so they don't have to spend money, and kind of gives them the look and feel that they've done something, that they don't have to do anything else, that they don't have to get a board certified reading because they've done AI, like the cardiopet of long ago. Hey, you've got something going on with this ECG. This is what's going on, and right now we know enough about ECGs to say, yeah, you need an echo. And that's my concern, is that guys, for $15, they think they can stop there, that they don't need a radiologist reading, and that's concerning. Yeah, some telerad consultations are $150 and versus $15, and it's like, that doesn't mean the practitioner should stop there, and that's what's concerning.
Well, then that also opens the door for liability too. And, who's liable when AI misdiagnoses something or prescribes or suggests that they put a patient on medications, and that medication ends up, creating a situation that didn't exist. You're removing some sort of liability there, or it might be more difficult. People are prone to sue when their pet gets sick or dies, just like in the human world, and they want to hold somebody accountable. And you can't sue AI. You can sue the clinic. I guess you can sue the owner. But
Yeah.
it is curious to see how you would circumvent the accountability or protect yourself.
And I would think that the veterinarians would want the best care for their patients anyway. So if they know that AI is not reliable, even if it is cheap, it's not the right way to go. Certainly not yet.
My experience as a practitioner and knowing other practitioners, you can market AI as reliable, unfortunately. You can market anything as reliable.
It's true, but of all of the ones that we've talked to and different conventions and things like that, we haven't found one that found it reliable whenever they really looked into it.
I attended an ACVR meeting in Phoenix a few years ago, not too many years ago, and there was an address, keynote speaker that was a human radiologist and was very actively involved in AI and the human side. And his opinion was it's going to be 10 plus years before there's enough training in AI, in radiology particularly, It takes hundreds of millions of samples of data to make it more reliable. I'm not saying it will be totally reliable. Last year's, not 2024, 2023 ACVR. I don't know, Dr. Taylor or Dr. Muller, if you guys were at that meeting, but there were three AI companies that gave their pitch to the radiologists, the diplomats in the room, and it was full. And I don't think I was sitting in the room. I'm not a radiologist, but the reaction to what's there was that it's not acceptable yet to most of them. And just to be clear, I think we're talking about in the context of AI in medical imaging interpretation, which is what Dr. Muller and Dr. Taylor do. But there's probably lots of other uses for AI in teleradiology, such as just before this meeting, I put in help me with radiographic positioning for a dog's scapula. Okay, and if that component and what I got was pages of how to do the lateral view, how to do the craniocaudal view, and I can get pictures and I can get documentation from universities and vet schools, et cetera. It's all there at our fingertips because it's been trained and given that data. So that's a very practical use of AI in teleradiology, because can you imagine somebody on our site getting ready to submit an image and a question pops up and says, do you need help with the positioning? Just another thought on AI and teleradiology other than interpretation.
Yeah, and I think it's going to be longer on the veterinary side because in human side,
Yeah,
those positionings are standardized.
right. They can tell their patients to hold still and take a deep breath.
Yeah. Between, technicians and the variability, it's like even for CT imaging of elbows, everybody has their own way of doing it. Jessica knows this more than anyone. It's like some people like them extended, some of them people like them slightly, flexed, but if you go on the human side, there's one way to do it.
That could be really,
Once-
really useful though at the clinic level, especially at the GP and even maybe emergency level where things are happening very fast paced, where it comes on and it helps you position a patient properly. Because for most technicians, unless you're a radiology tech, there is very little training on what that radiologist is actually looking for and what they need to see in an image. And it would be very useful if AI could come in and say, yes, this image is diagnostic, or no, this image needs to be retaken, or something like that, so that the technicians would have some kind of guidelines.
My experience from clients is all about x-rays and AI. Has anybody heard anything about other modalities like MR or CT and AI reading those types of scans?
Yeah, is combining, she's actually starting something, I forget which company, with MR interpretation blended with AI.
I do wonder, do you think that AI would be more accurate when it comes to those modalities versus x-ray?
It might be because you have to have rigid, fixed imaging standards for MR.
Yeah.
But the problem is that you have so many different MR machines, and every type of manufacturer likes to have their own sequences. It's how they make them different, whether it's Vibe or they all have their own imaging sequences. Makes them neat. So who knows? But yeah, I was surprised to see that she's working with some companies on doing some initial platform work with AI and MR standards.
Going back to what Dave said about how AI has different uses, not just on the veterinary side, but on the human side as well. How would you guys utilize AI in your own work? Maybe not from a radiologist standpoint, but let's say Jessica or Gracie or Dave. How would you use AI to help you?
I think we could definitely use it to help support the radiologist, especially like when clients are capturing their images, proper protocols, like Dave kind of alluded to or, discussed, is that, if you needed help taking images, you could click on a link and it would show you how to position your patient and what images you need to capture and things along those lines. There's some things that you could probably automate to or have an AI response to.
Well, like the one X-ray vendor that was from Canada, where it had the X-ray machines where you laid the patient down and it would automatically adjust the KVP and MA settings when you laid the patient down. You didn't have to do anything. It would adjust everything and take the image. You didn't have to do anything. You no longer had to manually dial anything in.
Yeah, that would be nice for sure. I could definitely see how AI could help with that, or it does. It's already exists. It does.
Yeah.
From my biggest thing is like obliquity, proper positioning, making sure that, the area of interest is in the center of your beam and not,
In
off
the
to the
abdomen.
side.
Cervical films aren't shot over the pelvis.
Yeah, there's no superimposition of other structures, things like that.
Well, I think AI may help the radiologist a lot by giving some draft reports. Like you have like a thorax and it automatically populates the report for you and you just make some adjustments or changes. I think some companies are working on that product right now. Also, AI would help us prioritize cases that are maybe more critical and need attention faster. If you have like 10 cases, AI could prioritize, the cases that was hit by a car or you had some changes that it's concerning for an urgent care. Or this is also something that companies are working on, making the workflow more efficient. I think that's going to help a lot, bring more efficiency and also maybe better patient care as well.
So do you worry that AI might reduce the value or autonomy of radiologists in the diagnostic process?
Not right now.
In the
Short-sighted,
Yeah,
short-sighted, no.
yeah, I'm not
5
concerned
years.
about that.
Yeah,
You're
5 years, no, but we'll see. Depends on how much is fed into it, right? If with the big companies that own the AI software, the big telerad groups that own AI software, the more the information they have, the better it can get. I mean, there is potential that it could have better accuracy down the road. But right now, I'm not really worried about it. When you're looking at a Chihuahua thorax and all the variability that you can see with it, it's like, I don't know how AI can get through that mess, you know?
Or exotics too. Think
Mhm.
about, our large animal.
Yeah, CT of an oxalotl, go for it.
Yeah.
Purchase exams on equines.
Mhm.
Oof. Talk about
Mhm.
some liability.
Exactly.
So how would you feel about relying on the data in, let's say, urgent or ambiguous cases? Would you ever rely on it?
It's going to be like another filter for you to work on. Like, well, you got it wrong this time, but eventually may get it right. I actually tested some AI softwares during my residency, and I published my residency paper on one AI software testing a specific finding of pleural effusion. And the AI did really well. It got pleural effusion in most of the cases, called some cases that were normal with pleural effusion and vice versa, but the accuracy was close to 90%. The thing is that AI doesn't know what to do with that. Okay, I found pleural effusion, but AI doesn't correlate with the clinical signs. You cannot tell if it's related to a pyothorax or something else, the other causes of pleural effusion. So it gives you a can report, like with a bunch of differentials. It's not really helpful, but it may help the clinician that is like all alone and it says to the clinician, oh, there's pleural effusion. I'm like, okay, that's helpful. But other than that, I don't think AI is ready for giving reports or correlating with clinical science, which is why we still have jobs, I guess.
So what kind of evidence would you need to see before considering AI as a reliable tool?
That's a great question, but I think kind of evidence that we will need is science behind it and proving that it is actually working. So testing the AI in a environment that it can be tested with some radiologists, because right now one of the discussions that they had in New Orleans, as they mentioned, it was a very heated discussion. People were marketing AI as accurate and blah blah blah, but they didn't test it. So how can you call it accurate? They didn't do any independent testing, And I believe that if an AI software that wants to be out in the market and wants to be reliable, it has to be tested by radiologists and clinicians and hospitals in the independent way. And then we can say, okay, it's accurate, it still needs a lot of work. And mainly I think AI has a lot of gaps. For instance, it doesn't compare to previous studies. It cannot do that. And I don't think it's going to be able to do that in a few years. And the clinical correlation, which is essential also, AI doesn't do that.
I think it's being marketed right now like cone beam CT was being marketed when cone beam CT first came out. It's being aggressively marketed for, and it can't really do the things that it's marketed, it's being peddled like snake oil.
Does AI, the program that you've used, does it correlate the history along with the x-rays? No, so the two don't. Okay, so AI is not able to actually correlate history. I do wonder if anybody is able to work on that or is investigating that.
Yeah, as far as I know, nothing has changed from what I researched previously, because I gave lectures about this last year. And this was one of the main issues with AI. It doesn't correlate with the clinical history. It doesn't compare studies yet. We'll see.
And what about if there was multiple modalities, if there was an x-ray and an ultrasound that were submitted on the same patient? Would those be read separately or?
Yeah. And I don't think we have anything so far for ultrasounds. I might be wrong. I don't know the entire market, but I think the main modality that AI is being marketed is radiographs, because it's the main modality that we use, and I believe that's good, for both companies and clinicians. But there was one study in human medicine saying that CT would be the ideal modality for AI, because it doesn't have any superimpositions or anything, and you can measure the Hounsfield units. So that would be the modality of choice for AI. So maybe in the future, CT is going to be, read by machines. Who knows?
Yeah, it would be interesting to test AI on a cone beam scan, a good one and a bad one, just to see what it would pick up, motion and all that different things that kind of influence a scan.
I think Dr. Taylor has to leave, correct? He has to go read cases.
Correct. Bye, everyone.
We'll miss you.
Bye.
Who would you trust to validate or recommend AI tools? Would you trust colleagues? Would you trust professional boards, studies? Who would get your trust?
I would say a radiologist or a university that has radiologists on staff. I think you also would probably need some of the input from all specialties too, just depending on the types of reports that are being generated. If it's making recommendations, if those recommendations would be appropriate, from an internist standpoint, would they agree with those interpretations and those recommendations? And I would say that's a blanket across all specialties. So I think I would need radiologists, universities with everybody on staff, private practices, specialty private practices with, specialists who have evaluated it and tested it and all that stuff.
Definitely independent studies, not those sponsored by the company that made the AI software.
I would think that some collaborative statement from ACBR that lends some support, that would be a group of everything you just talked about, from research radiologists to corporate radiologists to university radiologists to independent radiologists. If the ACBR comes out and says this is a plus minus negative or scores it, that would carry a lot of weight, I think, with a lot of people.
Mm-hmm. What skills or training do you think radiologists might need to stay ahead in an AI integrated future? Do you think that will make a difference in how
clinical correlation?
Clinical correlation.
I think a good radiologist has to be a good clinician, and clinical correlation is imperative. And also being a good human, right? AI won't be human at all. So you have to think about the patient care first. You have to know the case in order to make accurate recommendations. Let's say the dog went through echocardiogram, and then the study runs through AI, and the AI recommends echocardiogram again. Doesn't make any sense, right? So simple things, basic clinical correlation is imperative, and I think that's the main difference between the radiologist and the AI.
I will say this too, as somebody who works on the, the other side of telemedicine, is we often get a lot of cases that are submitted with incomplete history or no history. And so, how are you going to correlate anything when you have no patient history? Now, we always call the client and try to get some additional history, but what is it going to do in those situations where there's nothing, where it just says recheck?
Yeah, that's challenging for everyone, I guess, even for the AI.
Yeah.
Found blood in bed. That's my favorite history.
What was it?
Found blood in bed.
Oh, I've seen some real interesting ones.
Yep.
There are some cute ones too, right?
Oh, for sure.
So if AI generated findings were included in a case report, how would you want them labeled or presented?
You definitely have to indicate that it was interpreted, like this is an AI interpretation, and some kind of disclaimer. A lot of people have disclaimers that, interpretation is based, there's multiple factors, but is limited by the quality of images and things along those lines. So I think an additional disclaimer, alerting clients to that is going to be essential.
So who should be ultimately responsible for the final diagnosis when AI is involved?
I think anybody with DACVR behind their name, if it's in regards to, radiology things, obviously, if it's a cardiologist, then that's particular specialist, but definitely a human.
So do you think that in the future AI support could be a benefit or a concern? I know we all have mixed opinions, but if it really improves, what do you think? A benefit or a concern?
I think so far it's just out there. It's not doing much. It's just, yeah, because I've worked with some companies that generate AI reports. I'm like, yeah, here it is. And I'm gonna write my report. Sometimes it gets right, but just sitting there and becoming better and better, I believe, with all the training, but it still needs human input. And the latest paper on it, actually from Tobias Schwartz, who tested one of these AI softwares, which is one of probably the most famous one, it actually confirms that, saying that AI is probably not replacing, but helping humans. So far, I believe that. And I feel like maybe it's going to change in the future, but it needs probably a few years. I believe also, like maybe 15 years ago, one of the guys that was running one of the largest AI software for human medicine was saying that radiologists are like the coyote looking down a hill. It's gonna fall real soon. You know the coyote, the cartoon? I love that. I love that cartoon. It's so cool. Anyway, and he said that this was going to happen in 2016. Almost 10 years went by, and that didn't happen yet. So I believe that companies that are working on an AI software that is actually trying to help the radiologists become more efficient and accurate, those are the companies that are going to have more market share, I believe. Instead of the companies that are working, we will end up.
Yeah, I definitely think it's going to be used more as a tool to assist the radiologist. It might highlight some areas of interest that they may want to go circle back and look at. But maybe like in my work lifetime, I just don't know if it will completely replace a radiologist. I think we're always going to need them.
Right. And if it worked as a tool just to limit the percentage of error, maybe just human error in general, by having them focus on certain areas where they see something that may not be correct, where maybe there's an abnormality. I think it could be a really beneficial tool for that purpose.
Yeah, like dictation errors, that would be probably something that would be more of a reliable thing that I would buy more into is, AI could proofread a radiologist report. And if it, it sees something about like duckies and kittens running in the yard and the findings, you know, it could flag that and either bring it to the radiologist's attention or make a suggestion on how to correct it. But as far as reading out the images, I don't think so.
Basically, what I'm getting from this conversation is that it's going to be a tool, something that we can use, but not something we should rely on. There's always going to be a need for the human aspect.
I think that's what it should do. I think some people may try to make it a tool to replace the radiologist in general, but I think it should be used as a tool to help them.
I agree. I agree with that statement.
It's really exciting, to work in radiology and be able to see something growing up, not knowing what's going to turn out to be. Radiologists were always working with technology and trying to become better using technology. And I think this new technology, which is AI, is definitely going to change something that we do. I'm excited to see what happens as a radiologist.